Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Jen, thanks for joining me on Here for Good, the Inside Edition.
Thank you for inviting me.
I know you began your career as a practicing physician. Were there any experiences that influenced the way you lead today?
My first job right out of training was at what was then Memorial Hospital, which is now Virtua Mount Holly. I started as a clinician in the hospital. I had an outpatient practice, but the majority of my practice was as an inpatient doctor. And I think that experience really gave me the opportunity to understand really how difficult it is to be a clinician. Somebody would say something like, we need to do this because a decision was made in administration. And I didn't know who was administration. I didn't know, how they made decisions that impacted my everyday work.
Of course, that would be you now.
That would be me now.
Administration. Yeah.
And how we take care of patients. So when I look back on that, having those years really informed the decisions that I make today, because I understand the awesome responsibility that we have when we take care of patients.
Tell me about the guiding principles that really has sort of allowed you to transition.
Number one, communication with my team. A very smart gentleman once told me that you never want to be the smartest person in the room. So really being able to assemble a team and, utilize all of their expertise and their strengths to help inform the work that we do. I think that's really important. And then, the second piece to that is collaboration.
As the chief clinical officer, you're also a clinical educator. Tell me what makes a clinical educator successful.
The number one quality is just the desire to teach. Thinking out loud so that those individuals that are learning from you can start to understand the thought process around how we make decisions and how we take care of people.
What was it that was such a draw for you to want to have that as a major part of your professional portfolio?
Looking at health systems across the country, that really the most successful organizations are organizations that educate. So it really elevates the clinical practice of all of us when we are training the next generation of learners.
Is that what you're hoping it achieves for Virtua?
With the acquisition of Our Lady of Lourdes several years ago, we made that transition from being a community health system to a tertiary system. And quite frankly, with that came an organization that had a very robust and long history in education. I think that provided an excellent foundation for us to continue from there.
Through our affiliation with Rowan, is there anything about that specifically that you think made it and that particular partnership a good complement to Virtua?
We both have the same mission, and that is to, one, make healthcare accessible to our community. And with Rowan, it's to make education accessible to the community. It has proven to be, one of the greatest opportunities, really, of my career has been to watch that relationship evolve and grow and see the resources that it brings.
As being an alumni and a graduate of Rowan, are there any, what I would consider memorable moments that have sort of stuck with you?
Yeah, not one or two memorable moments, but what I will tell you is that a lot of the faculty that trained me are still training medical students at Rowan University. So there is, again, a very lengthy tenure for some of these individuals. And, I do have the opportunity to go back to Rowan and speak from time to time about leadership, about, what it's like to be a clinician in this day and age. So, those connections have remained. And for me, it's just really rewarding to see, these individuals, like I said, who, were young clinicians, barely out of training themselves when I rounded with them in the hospital, and now they're seasoned educators and they're training the next generation.
So what I took from that answer was that, yes, there are a bunch of memorable moments, but none that you want to share publicly.
Maybe. You're very astute.
Well, that's sort of what I got from it. So let's switch gears a little bit. You've been able to introduced several initiatives to address things such as clinical burnout, which we know is a major problem in terms of using ambient listening, and I think it's what's called inbox support.
Right.
Explain those two things and how you feel they help our clinicians.
Yeah. There are a lot of both physicians and nurses that are going to be retiring over the next decade. Again, we have all that data. We also know that we are not training them quickly enough to fill the void that is going to be left. So essentially, we are going to have to do more with less. So in order to support our clinicians in their everyday work, we do look for opportunities to take some of the burden off of them. The ambient listening tools are wonderful because I can walk into a patient's room. If you're the patient, I can sit and have a conversation with you, make eye contact. I'm not at a keyboard recording everything that you say because there is technology that's doing that for me.
Is it not capturing all of the conversation in a way that may not be transferable to a patient's chart, or is it weeding out some of the, chit chat that you might not want to record?
You're absolutely right. It knows when you have begun your clinical encounter. It knows that we're catching up about how are your kids. I heard your daughter got married a couple of months ago. How did that go? But this technology then knows when we have started our clinical encounter.
And what about the inbox support?
Yeah. At the end of the day, after you've put in your 8 or 10 hours, you might have 100, 150 messages in your inbox. So again, there are technologies that can read through that information and send messages to the appropriate person so that maybe the physician only needs to answer 10 of those messages. Maybe the others can be answered by somebody else in the practice. So, we are, again, working to try to alleviate some of the burden, make sure that everybody can work up to the level of their license and that they don't get bogged down.
Do you envision these particular strategies evolving? Are they getting better, particularly as you start thinking about AI and how that's incorporated? Do you think it's going to evolve over time in a rapid way, or is it going to take a little bit in order for this to get to where you would like to see it?
AI is a wonderful tool. It's here to stay. And we can, again, utilize that to really amplify the work of our individuals. But, there are some complexities around that. And I think we are all on a learning curve. And so we have to kind of dip our big toe in and get a little bit more comfortable, get our physicians and our nurses a little bit more comfortable with utilizing these resources.
Was there anyone in your family that inspired you to pursue medicine?
I came from a really, really strong family of individuals who believed highly in education.
Any of your children been inspired to pursue medicine or healthcare?
So, it's interesting. They're all very science motivated, not necessarily healthcare. So my eldest son, Ian, is actually one of the newest Virtua employees. He has a master's degree in data analytics, and he joined the DTO. My second son is a budding electrical engineer. My third son is pursuing a doctorate in physics. And my daughter, actually, interestingly, is finishing her master's and is applying to medical school.
Sounds like you have some great kids that are doing some wonderful things, and medicine is kind of sort of the family business with an outlier.
Right. Well, I'm very proud of all of them. And, I again, based on the way that I was raised, I always impressed upon them how important it was to get an education. But, wherever they take that and whatever direction they go in life, as long as they're happy, then I am happy.
And it sounds like you have them on a path to be here for good. And speaking of here for good, what does that mean to you?
It means that we're here for good. We are going to be a resource to our community in perpetuity. We're not going anywhere. And then the other way that I think about here for good is really we're here to do good. And we are here to, again, provide a service to this community that wouldn't necessarily be available if we weren't here. And it's not just healthcare, right? It's how we reach into the community and provide things that are needed, with our Eat Well program and our mobile programs and our pediatric outreach. There's such a need in our region. And so, Here for Good to me means that we are going to keep reaching out into the community, keep asking them what they need, and then trying to fill that void.
As Virtua's Chief Clinical Officer, or top doc as another way of looking at it, what are you excited about with respect to Virtua's future?
We're always thinking ahead of the curve. We're always looking at an opportunity or opportunities to partner with organizations. We talked about the Rowan affiliation and how transformational that has been. And, we have the potential for another partnership in our near future that, will just amplify all of the great work that we're doing. So, I think one of the things that I love about this organization is that we are brave in forging a path ahead, and we are doing what is right. And, going into areas where, again, if we're not there, there isn't anyone there to provide that care.
We are so fortunate to have you as our Chief Clinical Officer, and thank you so much for joining me on this edition of Here for Good.
It's been a pleasure. Thank you.
This has truly been a inspirational moment that I've been able to spend with Dr. Khelil, and I hope you tune in for yet another session of Here for Good, the Inside Edition.